So we're talking about eating disorders as motivation and self-determination. Eating disorders often come without warning. The signs that emerge are often observed when an individual is in critical condition. They're often in critical condition because their sickness is prompted by a weakness in the immune system, and it's not until they get some tests done that anyone realizes that they're actually sick. Eating disorders come from extreme conditions like poor body image, extreme physical goals, odd eating behaviors, social issues, financial stress, and resistance to others. We're now going to meet Audrey. When Audrey was 13, she was suffering anorexia nervosa. Her parents had worried about her for about 6 months before a medical test proved that she was anorexic. She was treated very quickly. Within 1 week, the doctors gave her a weight gain injection, and then she was sent home. Her parents were given instructions to supervise all her meals, and they even visited her school to ensure she ate during lunchtime. This seemed to work, but when Audrey was 18, she suffered a relapse, and then finally she visited an eating disorder consultant who talked to her and made her realize that she had to change her ways. Often with eating disorders, there's some kind of trigger. We're going to now talk about behavioral inhibition system, which is also known as BIS. It's a neuropsychological response to anxiety-driven cues. It's associated with vulnerability, disease, and threat. This increases negative emotions and increases the need for avoidance. Audrey was most likely experiencing emotional disorder, which led to her schedule of avoiding food. This may have been caused by a range of causes like peer pressure, body image, or unsafe home environment. Perhaps she was just isolated because her parents work. Either way, this resulted in alternating mood swings. According to Maslow's need hierarchy, Audrey was someone who was in need. She failed to achieve levels of personal growth. As you can see, looking at the pyramid, on rock bottom is psychological needs, food and drink. By taking away food and drink, she was just proving that she was failing to have her psychological needs met. And she didn't get over this bottom tier when she was 13 and also when she was 18. And this was also identified in a statement that she made after she had been treated when she was 18. She said, "Treat the person and not the illness," which prompts the idea that she may have identified herself as having a psychological need that failed to have been met. So we're now going to look at patients' personality and self-management. This is an article where it examines the relationship between personality and patient activation. The study shows that positive aspects such as openness, extroversion, conscientiousness are positive to patients' activation, whereas pseudo-criticisms are negative. Depending on certain individual differences, people look at diseases and choose how to manage it differently, but patients need to find a range of resources to adhere to medical regimes. They need to engage in regular exercise, maintain a healthy diet, seek disease-related information, stay confident, and cooperate with physicians. So the studies found that a positive attitude and eagerness to learn of responsibilities can assist in a speedy recovery. These points outline Audrey's response. To the left, when sick, a lot of negative thoughts and actions and inhibition. To the right, forward-thinking, active change to effectively overcome imbalance, clearly in positive mindset and effectively heading towards recovery. Audrey had to change her whole mindset so that she could recover. She had to understand her role and how to manage her behavior and mindset to be able to overcome her eating disorder. She had a need for growth, which was encouraged by motivation. So Audrey had to acknowledge many things, like how her feelings affected her activities, how to feel connected to those around her so that she felt she belonged. She had to choose what to do and be herself. She had to overcome obstacles and emotional curves to increase her well-being, and she had to make a self-determination a pivotal tool to recover. So she had to stop leaning on the negative side and start doing what that article said. She had to be open to change. She had to combat her disease or her illness with a positive attitude, so she had to switch from negative to positive so that she could recover.